Privatized versus nationalized healthcare has been a pretty prominent topic among American political debate and online political discussion. The United States is one of the only first world countries to not offer universal healthcare, and with the rising costs of health insurance, many Americans struggle to get access to healthcare. The biggest group of these people is young people ages 26 to 30. About a quarter of them do not have health insurance, uh, according to the National Library of Medicine. The government offers federal health insurance for people who meet special eligibility requirements, like the VA for veterans, Medicare for senior citizens, and Medicaid for non-senior citizens who make less than 138% of the federal poverty level. The problem with this is that there's a lot of people in between who often have to foot the bill of health insurance themselves, uh, or just foot the bill of a medical procedure, and that's because most employers in the United States don't offer health insurance. When someone doesn't have health insurance, they take a very big financial risk. Depending on the procedure, it can cost unfathomable amounts of money. Uh, the average cost of a heart transplant in 2020 was about 1.6 million, according to a Milliman research study. If an uninsured person needed access to a heart transplant for the sake of their life, then this would be an unrealistic amount of money for them to even pay, and it would probably financially ruin them. The problem, this problem doesn't solely lie with expensive procedures like this one. It also lies in the fact that many Americans will intentionally avoid going to the hospital because of the financial burden, and they will miss out on medicine that would be able to keep them healthy. And this has contributed to the United States having one of the lowest life expectancies out of any industrialized nation, ranked number 48 according to the United Nations Population Division. While competition is good for driving down prices for consumer, that doesn't always happen, especially with the healthcare industry. The healthcare industry in the United States is home to one of the largest monopolized conglomerates. Uh, the 10 biggest healthcare providers in the United States own roughly about 1/6 of all hospitals, and this has led to most regions only having one hospital. And when there's only one provider of a certain service in an area, they have a monopoly on it, and that basically means that they can charge people and offer their services as they see fit, and this is usually very expensive, and has contributed to the accessibility problem of healthcare. Uh, Monopolized healthcare also prevents innovations, which could be a factor as to why we haven't found a cure to cancer yet. When people advocate for universal healthcare, they often label free healthcare as a human right, which isn't correct. Free healthcare isn't a human right because it requires the resources and labor of other people. And if something requires the resources and labor of other people, it can't be a human right because nobody's entitled to the labor of other people. This isn't an effective argument for healthcare being universalized because because there are other services in the United States that people take as a privilege, not as a human right. And this would be like the fire department, law enforcement, like the United States Postal Service. These aren't human rights because they require the labor of other people, but we still enjoy them as American citizens because it's a privilege. And I don't see why we can't use universal health care as a privilege in the United States.